that it is high time that the private sector should really think about, increasing the salaries of our nurses and the other healthcare workers as well. Sito, we're not just talking about nurses here when it comes to the salaries. You have to realize that if you increase the salary of the nurses, then it also follows that you have to increase the other healthcare workers. No, it cannot be just limited to the nurses. You need to make sure that the salaries for, like, let us say, the medical technologies, the respiratory therapies, and even our very own doctors, no, all of them really had to have a higher pay. In even the doctors in the private sector, particularly our younger colleagues, no, they receive very few, very small amount of remuneration, and I think that we need to really address this particular issue, which is actually a very important issue, as it is something that is close to the, should I say, malapit yan sa sikmura. No? So, I think that it is understandable that the healthcare workers, in whatever field it may be, the medical field, the nursing, the med techs, no, they need to receive more because they are serving the people also. For every second, for every minute that they are there, there is really a risk, not that they have to face, and I think that we need to pay them well enough so that we at least we will be competitive with that of the other countries hiring them.
Is there or has there been a study, research, surveys, interviews conducted to determine what sort of a package would be good enough, not just monetary, but what sort of a mixed bag of offerings can be given to all our health workers that will encourage people to work for the DOH or the public hospitals, etc. Because as I listened to you, I was thinking, bakit sila, ilan ba sila? Hindi ba natin sila pwedeng bigyan tax-free or 50% income tax lang? Or can we give them, can we guarantee that they have housing, free housing? Are they given free transport passes? Kasi napapansin ko yan, especially during COVID, pag pinakita mong doktor ka, sige lang sir, sige na, diretso na kayo. But ngayon wala nang pandemic, parang you pay.
Yeah, right. No, I don't think that there has been any study conducted looking into the other benefits that can be given to healthcare workers, not just in terms of increasing the salaries, but maybe, as you said, other fringe benefits that we can get, so that if on top of this, on top of the salary, then maybe it can be worthwhile for them to stay in the country, to make them stay in the country. So I think kailangan government should think about this and really look into how, kaya nga sinasabi ko sa iyo, yung 1 year na extension, after their studies to serve the country can be a short-term measure, to address the current problem that we have, pero we need to have a longer plan, and that means that you need to really look into the factors that can lead to a more effective retention of healthcare workers.